Hey class, it's Miss Shodry. Today we're going through patient TPR. This is one of the many tools that we use and techniques that we use to help determine the overall health of our animal patients and actually also human patients for those of you who are thinking you want to do human medical field. Obviously, you taking your patient's temperature will generally not look like this, but same concepts generally apply. So, first of all, what is TPR? TPR is very simply just a set of vital signs that we take to help establish kind of baselines for health and how things are going. So, TPR stands for temperature, pulse, and respiration. In humans, we'd also do blood pressure. We don't often do that in animals, but it's just part of the vital signs that every time you go to the doctor, every time your animal goes to the vet, every time a vet comes out to the farm, those are some of the things that they will look at to kind of gauge the health of an animal. Um, there's two reasons for doing this. The first one is that it helps to establish a baseline. At the end of this presentation, you're going to see a slide that talks about what are the average TPRs for different species of animals. Individual animals vary within those baselines or within those outlines. And so being able to do and take a TPR every single time your pet goes to the vet, you go to the doctor, that allows the vet themselves or the doctor themselves to establish like if you're a little bit off of the norm. So, like the average quote unquote human temperature is said to be 98.6 degrees. Well, if you're a person whose average temperature is actually 98 degrees, a temperature of 99 is much more significant for you than for someone who's always at that 98.6. So, knowing how an individual animal differs from the general population helps us to better understand if something is off. It also, then the second thing is it helps to indicate that there's a development of problems. So if something in the TPR is majorly off, if it's been trending to off of norm for a while, that can indicate that a problem has been developing. It just kind of serves as another diagnostic tool that says, hey, something might be off. We should continue to examine or continue to monitor. It doesn't in and of itself mean that something is wrong. Like you can have a high blood pressure one day or be breathing too much. Your animal might be breathing too much one day, and there's lots of other reasons that that could occur that we'll talk about as we go through. So, just a tool like every other tool that we learn and that we use in the medical field. It's one of the ways that we can help. We can start to look at what's going on. So, first we have variations in temperature can occur due to lots of reasons. Health wise, infection and disease are a big concern. So, an infection is usually going to help cause the body temperature to raise. That's the body's way of trying to kill off whatever's inside it. I'm trying to change the ambient temperature so that that bacteria or virus gets destroyed. And it can also be an indication of excitement or stress in the animal. And it can also very easily be an indication of the environment they're in. If it's hot outside, the internal temperature of your animal can change due to that. Okay, sweating, running around, all of those things could affect that temperature. So, procedure. The first thing we want to do is make sure that the thermometer is clean. I think in this day and age, the importance of making sure everything is clean and washed is probably something we're all sick of hearing about, but it's very much true. We want to make sure that that thermometer, that tool is clean because we're putting it into an animal, and we don't want to take anything from the outside and now stick it into the insides of our animal with bacteria or something on it. If you're using a traditional old school mercury thermometer, then you want to make sure that it's shaken so that it's not warm from where it was being stored or cold from where it was being stored, what have you. And make sure that the mercury is down below 98 degrees, which is going to be down below what most of the ambient temperature for your animal should be. Okay? If you're using a digital thermometer, which I think most of us do these days, I know that's what we use in the classroom, turn the darn thing on. Okay? Next, if you are doing a rectal thermometer or rectal temperature, then you need to make sure that you lubricate the tip of that thermometer with petroleum jelly. Okay, if you're using a forehead thermometer, if you're using an ear thermometer, we actually have surface probes that we try and use too. Obviously, you don't need to do that, but if you're going to be sticking something up your animal's rectum, be kind and make sure that it's got some lubrication on it so you're not tearing, injuring, or just making them uncomfortable. The next thing we want to do is gently insert the thermometer into the rectum and hold it securely in place for 3 minutes. If it's a mercury thermometer, if it's a digital thermometer, you want to hold it until it beeps to indicate that it has got an accurate temperature. Um, most thermometers, you can tell that you've inserted it enough based on where it flares at the end that it's doing the reading. So, like in our digital thermometers, the far base of the thermometer gets much wider, so we stick it into the rectum until it gets to that point. Okay. Um, Once we've got our 3 minutes or we've got our reading, then we can go ahead and remove the thermometer, wipe it off with a paper towel to start. We don't want to be handling it, touching it too much because we want to be able to read it. We want to clean all of that extra petroleum jelly and anything that could have got on it from the inside of the animal. We want to remove that. And then we want to get our reading. Okay. With a mercury thermometer, then you're going to rotate it until you find the mercury level, take your reading, record your reading. And then at that point, you want to thoroughly clean off your thermometer, not just wipe it off. Again, we want to prevent the spread of pathogens. Okay, next, our pulse. So, pulse, just like temperature, is going to vary for lots of reasons. This one we probably see more variations with when we're testing animals, in the classroom because there's so many other dogs involved or other animals, but also the vet's office. Many animals get anxious or uncomfortable at the vet's because it's a new place. Maybe they've been put on the table and they don't like being up there. And so you're going to see their pulse increase uh, due to anxiety. Maybe they were just running around before they came in, but also they could be in pain. They could have a disease. They could be in shock, or depending on the species and the breed, those numbers could be very different. Yep. So, again, lots of things that can cause variations, and that's why it's important to just always be taking those every time you go in, establishing that baseline so that they have that background information to know, hey, Rover's uh, pulse is a little bit up, but it's always a little bit up when he comes here because he's just uncomfortable. And that's normal for him, so that's okay. It's not a major concern. Procedure for taking pulse: you're going to use your index and middle fingers, and you want to gently roll them over one of the arteries, one of the major arteries, to feel for the pulse. Okay? In humans, we're taught when we're little to do that generally one of two places, like under your kind of chin at the base of your neck, or at the inside of your wrist or outside of your wrist. With animals, there's a couple of different major places where we do that, and I'll show you that in a minute. Okay. But you want to kind of feel around until you find a spot where you can accurately feel that pulse. Okay. Then you want to count the number of pulses you feel over the course of 15 seconds. The reason that that's not the full minute is it can be very difficult depending on your patient to keep them still that long. And you can get a pretty accurate estimation by just taking the 15 seconds and then multiplying by 4 to get your beat per minute range or your beat per minute information. Um, you just get a much more accurate count when you're not sitting there trying to like follow your squirming patient. Okay, so that's how we take pulse. Main places we take pulse in dogs and cats is generally on the inside of the back leg. There's a major artery right there that's usually pretty easy to find. On horses and cattle, a lot of times we're going to do that like under the lower jaw, okay, or right along the side of the jaw. We can usually feel a good strong pulse there. And usually for most of our livestock animals, they're used to having and being held around their face. So that's pretty comfortable for them. It also keeps you well clear of their legs and their hooves. Last is respiration. Respiration, we actually look at not just the rate, so not just again that quantitative data, but we're also going to look for some qualitative data. So, number one, we are looking at the rate of respiration. How many breaths per minute are they taking? But then we're also looking at some things about those breaths. So, we want to look at the depth of the breath, like how much chest effort are they making? Is it a really deep, good breath, drawing air all the way into the lungs? Pull the lungs open, pop open the alveoli, and get good oxygen exchange, or is it really shallow? Uh, Frequent, repeated, shallow breathing can cause some problems with their health. An animal that's breathing more shallowly isn't getting good air exchange, and so they're not getting rid of enough CO2, and that can build up over time and cause the animal to have like cyanotic conditions, be hypoxic or low oxygen, and that can cause really severe problems if it lasts long enough. Okay. The other thing we're looking for is the character of the breath. Is it a slow breath? Is it a rapid breath? Is it normal? And then also, do we hear any like unusual sounds? Does it sound like wheezing, whistling noises, crackling, all of those different things that are going to indicate that, hey, this is not quite normal? Even if they're taking the right amount of breaths, even if they're taking nice deep breaths, even if they're breathing really slowly, some of those sounds can still indicate that something might be going on. So, respiration, if you're just getting the rate, you can do that really simply by watching for the rise and fall of their chest. This one can be really easy to just let the animal like lay down on its side if it's like a pet animal and be comfortable. Then you don't have to try to fight them. And then it's pretty easy to watch their chest rise and fall. You can also do this with a stethoscope um, and listen for the breaths. You want to count the number of breaths over 30 seconds. Again, because with our animals, it's sometimes hard to keep them still to do that. We try and do a abbreviated amount of time and then multiply by 2 to get your breaths per minute. In the video, I think she only does 15 seconds. Um, I've generally been taught that it's better to do 30 seconds because depending on the species of animal, especially for larger animals that don't have a very high breaths per minute rate, 15 seconds isn't enough to get in like enough sets of respirations to get a good accurate count. So generally speaking, respirations for 30 seconds multiplied by 2. Okay. This chart just lists the average TPRs for some of our common species that we work with. Um, Everything from cats and chickens to rabbits and snakes. Katie, there you go. Just to kind of check those out. I'm not going to ask you to memorize these by any means. I don't have them memorized. If you're not working with animals every day, I don't think that that's super helpful, but it is there for you to kind of go and check back to when you're doing your exams and kind of look. You'll notice that some species, most of these species, have pretty wide ranges. Again, there's lots of things that affect those average ranges, but probably the biggest thing is size of the animal for pulse and also a little bit for respiration. Smaller animals are usually going to have faster heartbeats and they're going to usually take more respirations. Larger animals take deeper breaths, have slower heart rates, and so they usually tend to be on the smaller side or the lower side of the spectrum. Larger animals tend to be higher. And you can kind of even notice this if you look at something like rabbits or chickens versus cattle. Okay, smaller animals, huge difference in the amount of beats per minute from a chicken, even within chickens, but chickens to cattle. Okay, so size, some indication, not necessarily the only thing. Goats are obviously pretty low, but good general rule. Okay. And as you can see, given these ranges, this is why establishing a baseline for your individual animal really is important because these are huge in some of these species. All right. Uh, Kind of just to wrap up, remember that TPR can fluctuate. Every single one of those measurements has reasons that it might not be quote unquote normal in any given situation. Excitement, stress, exercise, weather, seeing other animals around, all of those things can be perfectly normal, non like poor health related reasons that your measurement might be a little higher or a little lower in that given vet visit. And so TPR is meant to be informative. It's part of a diagnosis. It's one of the tools we use, but it's not the end all be all. If your dog one day has like a really high heart rate, might just be because they were really excited you were, cuddling with them as you were trying to figure out their heart rate. Okay. So hopefully this helps. No assignment for today. I will see you guys next week. Take care. Miss you guys.